This segment is sponsored by Mercy Health. May is Stroke Awareness Month. Dr. Patrick Pawlowski is a neurologist with Trinity Health in Muskegon. Becky Tony is stroke coordinator, also at Trinity Health Muskegon. And they are passionate about educating the public about how to reduce strokes and caring for and improving outcomes for stroke victims. And welcome to both of you. It's good to have you here.
Thank you.
Becky, I know some people may be surprised by some of the statistics around strokes. Can you share some of that with us?
Yeah, sure. Every year, 795,000 citizens in the United States have a stroke. It is the fifth leading cause of death in the United States. Every minute of ischemia when you're having a stroke causes 1.9 million neurons to die. So when you're having a stroke, that's like aging your brain by 3.6 years for every hour of ischemia. And 80% of all strokes could be prevented if people just modify their risk factors.
We're going to talk about those risk factors in a minute, but Dr. Pawlowski, talk a little bit about what happens when we have a stroke. What's going on?
A stroke is when there's like two types of strokes. First, we have to talk about like what happens in the process, and that big process is that there's not enough oxygen getting to the brain. So we talk about ischemic stroke, where there's a blood clot that blocks the blood flow to that part of the brain that's causing your symptoms. And then there's the other type of hemorrhagic stroke, which can occur when a blood vessel ruptures and causes bleeding on the brain. And then there's the last type, which we refer to as a transient ischemic attack, or TIA, that is generally referred to as a mini stroke. It produces stroke-like symptoms, but there's no lasting effects. And a lot of times those symptoms resolve on their own. But going forward, we need to reduce those symptoms from happening by treating risk factors.
Let's talk about symptoms though first. How will it present?
Okay, so we always use the acronym BFAST. B for balance or coordination, sudden trouble walking or dizziness. E is for eye, so vision changes, loss of vision, blurred vision, or double vision. It can mean one or both eyes. F is for facial asymmetry, so half of your face isn't moving the same as the other half. A is for arm or leg, numbness, weakness, tingling, or paralysis. S is for slurred speech or difficulty getting your thoughts into words, so sometimes it sounds like they're confused. And then the T stands for time, so time is critical. Every minute counts, so getting in quickly for treatment.
And what is treatment?
A treatment is a time critical aspect in which we look at getting a patient in within the 4.5-hour window. It's critical to get these patients to the hospital to be diagnosed as soon as possible through a blood test, through imaging, and along with a physical exam that we do when the patient arrives to the hospital. Once the patient arrives to the hospital, the chances of survival increases. The sooner you come in, the more likelihood you have of improvement later on. Once you arrive, there's medication that we can give you for certain types of stroke that breaks up clots. And these clots can then resolve the symptoms once they've been moved on along the way. It's important because Mercy is a comprehensive, Trinity Health now, the whole system is a comprehensive stroke center, and we're part of that spoke where if patients come in to see us, we can give them this TPA to break up the clot, and if there's more or larger clot in there, the patient can then be shipped to St. Mary's Trinity Health for a thrombectomy.
Okay, let's talk about risk factors. What are they?
So risk factors are things that we can change in our everyday. So some risk factors can be changed, like smoking, diet, obesity, high blood pressure, high cholesterol. Those are the things that we should really be working with our patients to make sure that they understand, making sure their blood pressure is under control. So under 120/80 is the American Heart Association guidelines for hypertension. So making sure your blood pressure is under control, making sure your blood sugar, if you're diabetic, is being well controlled. So getting that blood sugar checked on a regular basis. Those are just a few.
And paying attention and getting help quickly if you see those symptoms setting in. All right, good information. And folks, to learn more about Trinity Health and the services provided there, visit mercyhealth.com/stroke. Good to have you both here. Thanks so much.
Thank you again.
Thank you.